Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello and happy Thursday, everyone. Welcome to All County You and Your Doctor, sponsored by All County Healthcare. I'm your host, Dawn Graubert. All County Healthcare is a Medicare certified home healthcare company operating in Dade, Broward, and Palm Beach County, available to meet all of your home health needs for you or your loved one. For more information, you can contact All County at 954-717-7027 or info@allcountyhealthcare.com. Tonight, I'm excited. We have Dr. Allyson, Dr. Ally Bagenholm joining us, Dr. B for short. She's joining us in studio. Allyson Bagenholm is a board-certified family physician and the founder of Dr. B Medical, a concierge family practice located in Boca Raton, area of concentration of preventative health care, heart health prevention, and women's health, optimization and maintenance of chronic medical conditions. Dr. B is not your average primary care physician. With an extensive experience in urgent care and family medicine, she brings a well-rounded approach to patient care, treating everything from acute illness and minor injuries to chronic conditions such as hypertension, diabetes, and high cholesterol. Through her concierge practice, Dr. B focuses on personalized, patient-centered healthcare, offering same-day or next-day appointments, longer visits, direct access to her medical team, and telemedicine options for added convenience. Her mission is to provide high-quality, accessible care while building meaningful relationships with her patients, helping them stay proactive about their health and well-being. Dr. B Medical is located at 1905 Clintmore Road, Suite 202 in Boca Raton. And for appointments, you can reach the office directly at 561-757-5530 or info@drbmedical.com. All right, Dr. B, thank you so much for joining us.
Thanks, Dawn, for having me.
This is such a treat for me. We've been doing so many that are virtual and remote. I actually get to have you here in studio.
Yeah, it's a pleasure to be here. Thank you.
Tell us about your practice. Why did you go into medicine?
So my father was a physician, his father was a physician, and growing up, I used to help him at his office. He was an OBGYN, so I do little things around the office and then kind of graduated to more clinical things. And, you know, I got interested from there, and the rest is history.
And here you are.
And here I am.
Medicine, when your dad practiced, has to be different from the way you practice now.
Yes.
What have you seen, positive changes, how it's evolved?
Well, that's a double-edged sword. I would say with technical advancements, obviously, we have a lot more in medicine that we can do that, you know, was out of our hands then. We're relying on computers now. Back then it was go to the library or use whatever book references you had. So, you know, I think time and speed are in our favor now. The difference then, I feel like, though, is, you know, then they were able to spend a lot more time for traditional medicine, and now everything is so fast and driven that it has become more inconvenient in most doctors' offices.
It's been harder for physicians to truly, and I know people are going to say, oh, that's not true, physicians make a lot of money, but truly to make a living because of the overhead, because you want to provide good quality of care. You can't be a machine, but yet the insurance companies almost deem it to be,
right,
because of what they're reimbursing. So here you are, you're on this wheel, this rat race of getting your patients in, wanting to help them, looking at reimbursements, what Medicare allows, what insurance allows.
Right.
Is that what led you to being concierge?
Exactly. So, you know, as you had mentioned, I worked at a bunch of urgent cares, not a bunch, but a couple of urgent cares, you know, maybe 10 years prior to opening my own practice. And the ones who were more independently owned, you could kind of run at your own pace, but the corporate ones was just machine, and that's where I saw, you know, patient care suffered. It was all time, not patient. So, you know, I said, this is not the way it should be. I should be able to take time with my patients, which for both patient and physician, it's important. I need to have the time to look at all the previous records, their history, and compare it to what's coming in. And in the traditional practices, I didn't have time to do all of that.
Because I think what you said, it's right. It's twofold. It's for patients and for you as the physician, because patients want time.
Yes.
I want to sit down with you. I want to share my history. You want to get me to the point. If you're on an 8-minute visit, you're going to bound to miss something. Patient satisfaction is going to go down.
Yes.
And then you miss it too, because you're not doing what you went into medical school for.
Exactly. You don't have time to ask the right questions and wait for the answer. It's just a lot of rushed, oh, I have a cough. Okay, here's your prescription. Not, hang on, talk about it. Let's see, what is it? Maybe it has nothing to do with respiratory. It could be from the stomach. It could be from allergies. But you have to be able to have the time to talk, get the real history, which is what we're taught in medical school. 90% of your diagnosis is based on your history. The rest is physical exam, sometimes labs, etc. But I'd find that's the most important thing.
What does a concierge practice or patient visit look like for people who don't know?
So the way I run my particular practice, which is similar to most concierge practices, I try to get patients in same day or next day for acute visits. So if they're sick, something's going on that's not normal, they call the office and they get right in. And then, you know, there's longer visits. So my first visit for each patient and for their physicals are scheduled for 60-minute slots. Follow-ups are between 30 to 45 minutes, which is completely different than, you know, the 10 to 15-minute spot you have in a non-concierge practice, which, you know, for a first visit, most of the time 60 minutes is plenty to get through a first patient visit, but I've had some that went over that because, you know, there's extensive medical history sometimes. So that's where I have the time and the capability to, okay, if I'm waiting and it's over 60 minutes, my patients know I'm not usually running late. So if it's 10, 15 minutes, they usually say, it's okay. I would want that extra time too if it was me on the other end.
It's funny, the first time I went to my concierge physician, I sat with her, we had this whole conversation, and I'm thinking, you have all the time to do this with me? It's such a different mindset of what you're used to.
Right.
Typically, you're in the waiting room, you're waiting, you're looking at your watch, and you're always running, someone's always running late because that's just the nature of medicine, right?
Right.
Things occur, things happen. And there's no one in the waiting room, and I go in, we're having this whole conversation. How are you? Can I get you a glass of water? And I'm thinking, this is unbelievable. Is this really, you think it's a one and done. But every time you go back, if you have got the right concierge physician, it's such a great opportunity. It's a great relationship because you really get to know the patient.
Right.
Right, you get to know the ins and outs. It's not me just calling and saying, Dr. B, I've got this.
Yes.
Because sometimes I'm feeling great, or your patient feels great, but then there's a nuance of something, and you can just call you and
Yep.
you
Exactly.
get through the point.
Yep, it's nice. And to your point too, you know, I'll sit down and first 10 minutes, 15 minutes, we may catch up, haven't seen each other in a while. Hey, how's the family? How was your trip? That's the really nice thing that we all like. I mean, it's not just me in my office, you know, I have other people there, and we all know people and our patients and their families, and usually what's going on, they just moved, their grandkids just came to visit, where did they go for the holiday, you know, so it's, for me, it's like a small little family.
And you talk about you specialize in preventative health, heart issues, women's health.
Yes.
What type of preventative health? What are we looking at?
So when I have the time, and many patients now who are, you know, more health savvy come in to me with, hey doc, can we check these labs? I read online that this is really good for heart health, or these are the screening tests I've read about, or somebody told me, you know, that this should be good. Many times I've already run them, they just didn't really know. Or I'll say, yeah, absolutely. For heart health prevention, if somebody does not already have a diagnosis of heart disease, I will sit with them and look at their family history and say, all right, let's start with what's the family look like? If there's an extensive family history of heart disease, but my patient doesn't have heart disease, maybe they have high cholesterol and they're really shy to go on any medication for it, then we'll kind of talk about, all right, maybe we need to check and see. Do you actually have heart disease and we just don't know about it yet? So I find, when you work with the patient and talk with them and give them the information, you make a plan together and not just, here's your prescription, don't answer any questions. I think it makes
It's an individualized approach.
It is.
Which is a great point, because a lot of families, I think my family, everyone's got heart disease. I'm not really big on wanting to go on extra medications because that's just for me.
Sure.
But to know that I could sit with my physician and say, what, can we make a different plan? And then you look at what type of test would you potentially order that you would look at?
So aside from your cholesterol screening test, there's a test called a coronary calcium score, which is a CAT scan with no dye that takes a quick picture of the heart, and it looks at the heart arteries to see if there is any calcium around the arteries. And if you see that, then we know that there's plaque, and then we make a decision depending on how high the score is. And looking at family history and the cholesterol panel, what do we want to do about it? And sometimes it's just modify your diet and let's recheck your cholesterol and see if you can get the cholesterol down on your own. Sometimes it's more than that. Sometimes I've done it on somebody just willy-nilly. We had the conversation and found that somebody had really severe heart disease, got them in, needed a stent, had zero symptoms. So, I look at it from that perspective too. Those patients that's happened to, they come back and say, you prevented a heart attack, you helped do this when we had zero idea that there was such severe heart disease.
And it's because you had the time to actually sit with the patient. You didn't just look at a number.
Exactly.
And the patient had enough time to sit with you and say, these are my concerns. Some patients, I think now, I don't know, maybe we're younger, maybe we're looking at more holistic care. We're not all so apt to say, let me have a pill.
Right.
I think it's a different generation. We want more information.
You are 100% correct. Yes, when I trained in residency, it was a different population. I trained in South Carolina, and it was not like down here. A lot of people come already educating, already coming with their questions ahead of time, and so they want to do something better. A lot of it is, I want to prevent this, or I don't want to start a medication, but I want to do non-medication treatments. What are my options? What can we do? And then we make up a plan, and then we follow it and see, if that change is making a difference. And if it is, we leave it there, and then we just monitor it.
So you'll work with food, lifestyle changes. You'll really give a whole visual of what we could look at.
Absolutely.
Makes a big difference.
It does.
All right, we're going to take a quick commercial break. When we come back, more with Dr. B, more with Dr. Allyson Bagenholm, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. You can reach All County at 954-717-7027, or info@allcountyhealthcare.com. They do everything from skilled nursing care to private duty aides, light cooking and cleaning, and even driving for your loved ones, as well as nursing care. So give them a call for any questions that you might have, or reach them at info@allcountyhealthcare.com. Tonight I'm here with Dr. B, Dr. Allyson Bagenholm, and we're talking about primary care and the change of a concierge practice versus a traditional primary care practice. Welcome, Dr. B.
Thank you.
All right, we were talking before we went to break about healthcare, preventive healthcare, and different things that we can work on: nutrition, exercise, maybe always not needing meds.
Right.
What do you do with women's health?
So women's health, same. A lot of it is, how's your diet? What are you doing for exercise? Many women are interested in their hormones, whether it's for bone health or, aging gracefully and youthfully. Heart health too goes with the hormone replacements. So, there's a lot of lab work that we draw to sort of check and see what are the numbers. But honestly, I'd say women's health and hormone replacement is, it's another conversation.
A lot of people are looking at and not realizing that they need. I remember when I started with my physician, I feel like every week I'm telling you more personal stories about me. Everyone who's listening to this. But I was going from one physician looking at one set of labs to another, and by the time all the labs came back, something else was off, or I was just feeling lethargic. I was just getting to an age of menopause, perimenopause, whatever you call it. I was just not feeling great. Mm-hmm. I needed a gatekeeper, but I didn't know I needed a gatekeeper.
Right.
And I feel as if it sounds like this is what you do.
I do, yes. And I hear this story over and over again. And many times, patients, whether it's a man or a woman, but oftentimes it's a woman for various different reasons. Fatigue has to be one of the most common complaints, and trying to figure out what is causing the fatigue is, it takes a lot of digging and a lot of work. But sometimes it is. The clues are there from other doctors' labs, but they just haven't put the pieces together because they only see their portion and they're not seeing everybody's. So sitting down with the patient, talking about symptoms, and then looking at all the labs or even history of labs and how those have trended is really important. I have found many times just by looking at the trends, people may not actually have a diagnosis yet on labs, but the story matches. For example, I have people with iron deficiency where their iron levels on the lab work looks normal. It's all in the normal range. But when you go backwards and you see it, you see that it's been dropping, and the red blood cell sizes have changed size. So I can see the trend, it just hasn't quite happened yet. So again, takes time to look at that, listen to the history, and put together. Could it be thyroid? Could it be hormones? Could it be iron? Could it be different vitamin deficiencies? Could it be your adrenal glands? I mean, the list is endless, but that's where taking the history and looking at the labs and breaking it down can make a big difference.
You even talk about adrenal glands and cortisol. A lot of physicians, I can't say all, but a lot, don't run them, don't look at them, because they're busy. They're so busy trying to get everyone in and out, right? They'll look at your red blood cells, your white, maybe your thyroid panel that's not showing up, your cholesterol, but they're not really getting into the other things that you just talked about.
Right.
Why is that so important?
Well, number one, those are more complicated labs. Iron, not so much, but cortisol and adrenal glands are it takes a lot more finesse and a lot more time to kind of dig, because if you find one abnormal, now you have to go digging for the rest of them and figure out which direction is it. So it is, unless you're an endocrinologist and that's your forte, I'd say most physicians don't necessarily like to draw adrenal type stuff because it's tricky. But, once you find a problem, then if you need to refer to a specialist, sometimes that's the easy answer also.
And having a primary physician, having you as a physician, say I needed to go an endocrine or I needed a cardiologist, would you help me get that appointment?
Yes, especially if it's something more urgent. We definitely will set it up for you, or at least get the ball started so that office may call the patient, because many times the patient will call that specialty office and it may be 2 months, 3 months, 6 months down the road to get something. So yes, we do help to coordinate those.
And you also do pre-op labs, which is really important as well.
Yes. Mm-hmm.
That's one of the hardest things to coordinate, I think. You're going to have a procedure done and you need an EKG and you need labs and you need a chest x-ray. And you're thinking now as a patient, you were just told that you need a procedure, which means there's something going on. And the last thing you want to do is start calling around, trying to find the right physician to get you clearance for your procedure.
Mm-hmm. Yeah.
Call you and you're like, I got this.
Yeah. So, well, for my patients, yes.
Yes.
For a couple of docs in town that use me, they send their patients to me for just pre-op. And those patients don't necessarily need to be my concierge patients. But otherwise, yes, that's a common issue, and we did that a lot in urgent care when I was working urgent care, because people either had a primary and couldn't get in, or were scrambling, where can I get my EKG, my chest x-ray, my labs, and somebody to clear me. So
because then you need it done timely, right? You need it done within probably 10 days if you're having a procedure.
Yep.
And you're trying to figure out how I'm going to get it done and what physician's going to see me, and then make sure everything gets to the hospital or the surgery center where it needs to get.
Right, and know my history. So that is definitely a challenge. Even in urgent care, when I used to do urgent care, you meet somebody for the first time, you take a history, but it's not exactly the same as you know a patient, you follow that patient for years, so you really know their history. That's happened plenty of times, and somebody didn't tell me what their medical history was at an urgent care. So you clear them, and then you might find out later, oops, they didn't tell me they were on this, or they didn't tell me that. And many patients don't realize certain medications or certain medical history makes a big shift in how you're going to clear them, or the risk that surgery will be to that patient.
It's such peace of mind, I find, to be able to have a physician like you that says, you know what, let me coordinate this for you. It's one less thing I feel the patient has to worry about. You got enough to worry about now.
Sure.
You're going for a procedure, you're not feeling well. To know that everything is being done appropriately, properly, sent where it needs to go, it's a huge stress relief.
Sure. Yeah, and we try to coordinate that pretty seamlessly. Usually either our patients will call us, say I have a procedure and my girls are on it, hey, when can we schedule you? Let's do this. Many times my office does it first. We get the pre-op orders from the surgeon's office, and then my girls call my patients and say, hey, we see you have a surgery coming up. How soon can you come? So it is, but it's nice, I think, for the patients to know that everything's under control.
And for everyone listening saying, I need to go see Dr. B, sign me up, how does it work? Is there an annual fee plus visits? How does it work with insurance?
So when we typically have you come in for a complimentary meet and greet. So you sit down with me for about half an hour to just talk about the practice and how exactly the practice works. And then if patients decide to sign up, yes, there's an annual membership fee to keep the practice small so that I can have those extended visits and get you in same day or next day for an acute appointment. And then we do bill insurance. So the membership fee is just belonging to the practice and keeping the practice to a small size. We do bill insurance for medical office visits. So, if you have a copay or a deductible, you're still responsible for those, just like any other doctor's office visit.
And then you have more access to you and your staff.
Yes.
Which makes it a whole lot easier.
It does.
What are you finding with the practice? Are you enjoying doing it this way? You see a difference in how you're treating patients?
A big difference. Yeah, I enjoy it, and my patients enjoy it. And that's the big shift from when I did not do concierge medicine, where everything was rushed and it was just, see as many as you can as quickly as you can. I felt then like I was missing things, and things were there, and I would tell patients, something's abnormal, but I don't have time to figure it out. Go see whoever your specialist is. And now I can actually sit down and say, something's wrong. I'm not sure what. Let's do some digging before I just start sending you somewhere. Like, I'd rather, if I need to send you to a specialist, I'd rather send you to the right one and not just pick 3 of them and hope that they can figure it out. And that's even patients coming in, new patients coming in. I've heard them say that to me. I just went for my physical with my non-concierge doctor, and I saw him for 10 minutes, didn't get to ask any questions, and then they gave me 5 referrals, and I don't even understand why.
And I feel like for you as a physician, it has to be a better quality of life-work balance
It
as
is.
well.
Yeah.
Maybe why you actually went into being a physician in the first place, what you wanted to do.
Right. It is. It's definitely better because your patient load, same thing. I mean, on a non-concierge practice, I would see maybe 30 patients a day. So that's talking to those patients, not having time to fill the charts in, review the labs. You have to do all that before or after. It cuts into family time. So now I pretty much, there's some exceptions, but I pretty much just do everything at work. And then when I'm home, you know, I go pick up the kids, go to their sport activities, cook dinner, you know, do all the family stuff. So it's a much better work-life balance.
You can be a mom, you can be a wife, you can be you.
Yes.
You can have some of your own personal time as well as help patients.
Right.
And for those, if it's not preventative care, I know I only have like a minute left to do this. You work with acute as well, diabetes, chronic illness, acute illness.
Yes. Yeah, all those. So high blood pressure, diabetes, heart disease, you name it. Those are things that I'll follow. And then for acute illnesses, if people come in with fever, sore throat, cough, upper respiratory symptoms, abdominal pain, then we get you in and we try to figure it out.
Oh my goodness. Thank you so much for joining us.
You're welcome.
That goes
Thanks
so
for having
fast,
me.
right? It's
Yeah.
a quick 30 minutes. For more information, reach out to Dr. B, Dr. Allie Bagenholm. You can reach her office for appointments. 561-757-5530, located at 1905 Clintmore Road, Suite 202. Definitely give her a call, have the consultation, have the conversation. It's all about you, preventive care, better health, and a better you. Have a great night, everyone. Stay safe. Be kind to each other. To reach All County, you can find them at 954-717-7027. And until next time, have a great week.